So my topic is performance assessment of 4 predictive scoring systems regarding perioperative morbidity following metastasis spinal surgery. Regarding spinal metastatic surgery, predicting postoperative morbidity is paramount for surgical decision-making process and patient counseling. Currently, the most prevalent available predictive models are Metastatic Spinal Tumor Frailty Index, the New England Spinal Metastasis Score, Modified 5-Item Frailty Index, and the Spine Oncology Morbidity Assessment Score. Nowadays, there is no consensus about which scoring system has the best predictive ability to predict postoperative complication. So, the aims of our study were to evaluate and compare the accuracy of the 4 scoring systems to predict perioperative morbidity after surgery for spinal metastasis, and to identify risk factors for preoperative complications. This retrospective single-center analysis included all patients who underwent surgery for spinal metastasis from 2007 to 2021. The data were collected included demographics, laboratory data, oncology, surgical data, and medical comorbidities. The primary outcomes were postoperative medical complications within 30 days and 90 days. All patients were scored using each of 4 predictive scoring systems. Then, each score were assessed using ROC analysis to quantify predictive accuracy. On the other hand, we used stepwise logistic regression analysis to identify risk factors of 30-day and 90-day morbidity. Results. The MSTFI had the highest area under the curve for overall complications and major complications at 30 days postoperatively. However, the Thamrong test showed no significant difference between the various areas under the curve for each score. As you can see in the slide that the area under the curve for all predictive models were less than 0.7. At 90 days postoperatively, the MSTFI also had the highest area under the curve for overall complications and major complications. And again, the Thamrong test showed no significant difference between the various areas under the curve for each score. Multivariate logistic regression model revealed that the risk factor of 30 days morbidity included pulmonary circulation disorders, emergent operation, Frankel grade A, B, or C, chronic lung disease, and preoperative chemotherapy. The risk factor of 90-day post-morbidity included emergent operation, chronic lung disease, preoperative chemotherapy, ECOG performance status 3 or 4, and preoperative anemia. To summarize, our studies found that most predictive models have limitations in predicting the morbidity following metastatic spinal surgery. Among the 4 scoring systems, the MSTFI showed the best performance in predicting short and medium-term morbidity in our study population. However, it did not meet the threshold for clinical utility. The risk factors for postoperative complications included patient comorbidity, poor preoperative performance, and neurological status, anemia, preoperative chemotherapy, and emergent operation. Future prospective external validation with large population is encouraged. Thank you for your attention.